We are back with Dr. Courtney Alexander. Okay, so welcome to Viva Eve.
It's an honor to be here.
We're going to talk about how September is Gynecologic Cancer Awareness Month. I didn't realize that there was so many. I wanted to ask you about what are these cancers that we should know about?
So there are many, but I think there are 5 that are prevalent enough to keep in mind and to discuss.
Let's go through them.
Okay.
Number one,
let's start with the most common gynecologic cancer in the U.S. That is uterine cancer. So that's specifically endometrial cancer, which is the endometrium is the lining of the uterus. And so that's what sheds every month when you get your period. Something that may make us point to or get suspicious for uterine cancer would be abnormal bleeding, whether that's after you've gone through menopause, if you start bleeding again, or bleeding between periods, things like that.
So it's uterine cancer is the most common. Who is the most likely to be diagnosed with it?
It's most likely going to happen for women who are postmenopausal, so after they've gone through menopause. However, it can happen at any age, and so if you are having abnormal periods, definitely something that you should come in for.
Okay. Number 2, what's the second cancer we should be thinking about here?
Not the most common, but something that can be quite dangerous and is not something that we have found a way to effectively screen for yet, is ovarian cancer. And so that's something that you really want to be on top of signs and symptoms for.
Yes.
So if you notice that you're feeling bloated, if you're getting full a lot quicker than you used to, or if you're having a lot of pelvic pain, those are all signs that you want to come in and get checked out.
I know ovarian cancer is really...
That one can be quite deadly.
Really deadly. Like I always hear about, it wasn't until stage 3 or stage 4.
Yeah.
And it gets really scary really fast.
There's different kinds, right? And so there are certain types that are more likely to present in older patients. And for those patients, you tend to look for like the pelvic pain, the getting full quicker, and the bloating. However, there are rare and other types of ovarian cancers that can occur in any age group. Some of them more popular in women in their 20s and 30s or younger. So it's pretty tough to say that one specific age would be for that.
Okay, so we have uterine, we have ovarian. What's the third cancer we should be thinking about here?
Cervical cancer. So that's why we always need to keep up with our pap smears.
Okay.
Getting them every 3 to 5 years or closer together, depending on what your OBGYN recommends.
First one should be at age 21?
21.
Would you ever get it younger than 21?
In specific rare situations, that's pretty individualized. So that's something that you would want to talk with your doctor about.
So I know we have a lot of patients who have daughters that are growing up. We are trying to talk about these things with our family members, with our daughters, so that we can be this voice of awareness. It's just like, hey, I had to get tested for this. This is going on with me. Maybe it's a niece, a daughter, a best friend's daughter, whatever it is. It's so important to keep talking about it.
Yeah.
Even though it's kind of scary.
It is. And people are starting to talk about it more. And it is a big deal because a lot of GYN conditions run in families.
I thought you got a pap smear every year.
You can get one every year. And it's individualized. If you haven't gotten one, go now. And if after you get your first one, depending on what the results say, your OBGYN will tell you how often you need to come back.
Is it easier to catch cervical cancer than uterine or...
So uterine cancer is the most common cancer, and it tends to be caught quite early.
Okay.
However, cervical cancer, the prevalence of it has decreased drastically since we started doing pap smears and started doing them more frequently and introducing HPV vaccines. And so as long as you are on top of your pap smears, we have a really good way of screening for it, for trying to treat it before it becomes cancer, just like anything else. If you are late on your pap smears, any type of cancer can progress and become dangerous.
So number 4. What's number 4?
So I'll group them together, so vulvar and vaginal cancers. Those may present with bleeding, pain with sex, discharge, burning, pain. Okay. So a lot of people will notice bleeding after intercourse.
Okay. And vulvar and vaginal cancer? What is the difference?
The vagina is the canal, and then the vulva is the more external genitalia for the women, and it's a minor difference.
Is it more of like where the cancer cells are discovered?
Yeah, so it's where the cancer cells are.
Okay,
but they're both rare, they're both similar in presentation, and somewhat similar in treatment. Who
is being diagnosed with this? Is it older women? Is it everybody?
So again, it tends to be older women. However, it can be people who have had persistent cuts, lesions, scarring, irritation, scratching in the area. Those sorts of things can put you at higher risk.
And so you would group number 4 and number 5 together as vulvar and vaginal cancers. So those are the 5. Recognizing the signs of these. Cervical cancer, we're looking for bleeding and pain during sex.
So you can have pain during sex, and a lot of people will notice with vulvar, vaginal, and cervical, they'll call it postcoital bleeding, which just means you bleed after you have intercourse.
Great.
Yeah. Women cannot catch a break.
Can't. Ovarian cancer, bloating and pelvic pain.
Exactly.
Okay.
So that one's tougher to catch early, on top of your symptoms, and if you notice something might be wrong, go get it checked out.
Okay. I have bloating and pain all the time. So it's like, what does a screening look like?
So let's say somebody comes in and they have some pelvic pain. So I'll do an exam. If I feel that there might be a cyst, a big mass, or some type of abnormal finding during the exam, then we'll follow that up with an ultrasound. Try to get some imaging. And if that looks abnormal, we get lab work and we go from there. Got it.
And then we have uterine cancer. And that's, we're looking for like super heavy periods, bleeding even after menopause.
Bleeding between periods, heavy periods, abnormal periods. Okay. If you start bleeding again after you've gone through menopause.
And then vaginal and vulva. You said unusual discharge, bleeding after sex, and then that persistent itching, burning, or skin changes. Okay. All right. Well, God help us all.
Yeah.
That's all I have to say about that. But still important, September, Gynecologic Cancer Awareness. If you have questions, if you are curious, if you want to talk to anybody, please get in touch with us. Obviously, you can DM us, call Viva Eve. I mean, we have such incredible doctors. Dr. Courtney Alexander is kind of fresh to the practice.
Yeah.
And
excited to be here.
Stoked for it. And thank you. Thank you for getting on here and talking about probably the least fun topic we could possibly mention.
It was fun to raise awareness.
I know. That, honestly, it's like, that's the most important part. I think we are flooded with constant media and information, and we forget, oh yeah, like I am at risk. Just being here and being alive. And what would you say, is there a certain point where you should definitely, if you haven't been to the doctor in 5 years, please go at this point because things start to change?
I would say anytime after 21, because especially with cervical cancer, we can do a lot if we catch it early. But
always, detection is everything.
You don't want to let it progress. So.
Got it. All right. Well, thank you. Yeah. And appreciate it. We're just going to keep on keeping on. All right. Thank you, doctor, though. Appreciate it.
No problem.
And then we're going to do